Great. Good afternoon. I'm Joey Wender, Executive Director of the Shelby Coalition. It's my pleasure to welcome everyone to today's webinar entitled Transforming Rural Health, Understanding and Leveraging the Rural Health Transformation Program. This is a $50 billion with a B, billion-dollar program that represents a major opportunity to strengthen rural healthcare systems. The purpose of the program is to transform the rural health ecosystem by strengthening care delivery, improving health outcomes, and expanding access to essential services, and stabilizing the financial future of rural providers. This webinar will provide a comprehensive overview of the program, including what it funds and what are its overarching goals, as well as examine how various states are approaching implementation. Our incredible list of speakers will also discuss how anchor institutions, nonprofits, and rural providers can benefit from this funding and how it differs from the existing funding opportunities, such as the FCC's Rural Healthcare Program, which is part of the Universal Service Fund. We'll also explore opportunities to better integrate digital opportunity initiatives, such as broadband access, digital skills, and technology adoption into healthcare delivery systems. So to bring this discussion to life, our conversation will be led by our terrific policy counsel, Kristen Cora. And before we get started, just a reminder about the logistics of the webinar. The webinar is recorded and will be available on our website afterwards. Audience members are muted, but are encouraged to use the Q&A box, not the chat box, but the Q&A box to send us your questions for the panelists. As always, you should follow us online at Shelby Coalition on LinkedIn, Facebook, X, and YouTube. Also, we want to thank our corporate sponsors, Ready, Zayo, T-Mobile, Cisco, and Tarana. We would not be able to engage in our work without their essential financial support. And finally, if you enjoy and value these webinars and you're not already a Shelby member, please do consider joining today. All right, it's time to turn our attention to the issue. And with that, I will turn it over to Kristen Cora to introduce our tremendous lineup of speakers. I'm really looking forward to this conversation, guys. Thank you.
Well, thank you, Joey, and thank you so much to our panelists today for taking the time to discuss this important and exciting funding opportunity. Also, thank you to all of our listeners out there for joining us. We hope that you find this insightful and helpful. Just as a reminder, this webinar will be 45 minutes. We've got a lot of dynamic conversation teed up. As Joey indicated, if you have any questions for our panelists, please provide them. You can put them in the Q&A box and we will do our best to field them and to answer them during this webinar. So joining me today are four incredible speakers who are tracking the progress of the Rural Health Transformation Program. We're going to call that the RHTP during this webinar. So first up, we have Sarah Bauman. Sarah is the Director for Telehealth Services for the Utah Education and Telehealth Network and the PI for the Northwest Regional Telehealth Resource Center. Welcome, Sarah. Second, we have Michael Wallace. Michael is the Assistant Director for UAMS eLink. Hi, Michael. Third, we have Sean Doherty. Sean Doherty is the Principal for Digital Opportunity at HRNA Advisors. Hi, Sean. And then last but not least, we have Jordan Rogers. Jordan is the Director of Relationship Marketing for the North Carolina Telehealth Network Association. Welcome, Jordan. So to begin the conversation today, we're going to jump right in. We'd like to provide some background information about the RHTP. So I'm going to turn it first to Sarah. She's going to help begin this discussion. So Sarah, for those who might be unfamiliar with this funding opportunity, can you tell us exactly what this program is about? So what initiatives does it fund? What's the timeline? What are the goals? How much money are we talking about?
Thank you, Kristen. Good afternoon, everyone. I'm really excited to be here with you all and appreciate Shelby for hosting this webinar. So as Joey mentioned, this is a transformative program. So it's the most significant federal investment in rural health that we've seen in a generation. Today, our goal is really to give you a practical understanding of what RHTP is, highlight how different states are approaching it, and where the biggest opportunities lie for broadband and anchor institutions. I would also encourage everyone to reach out to your state rural health office for more information, and you can also go directly to CMS. So as the slide notes, RHTP is a $50 billion federal initiative to modernize rural healthcare, address workforce shortages, and support technology adoption. It was authorized through the One Big Beautiful Bill Act. This is not a small pilot program. It is a 5-year, $10 billion per year investment that states must implement strategically and demonstrate progress on annually. CMS evaluates each state's performance every year, and continued funding depends on program objectives and outcomes being achieved. First-year awards were announced in December of 2025, and they range from $147 million in New Jersey to $281 million in Texas, with most states landing around the $200 million mark. And importantly, all funds must be spent by October 1st, 2032. So what this means is that states are not just planning for short-term projects, they are building multi-year transformation strategies that require strong partnerships, strong data, and strong infrastructure. Next slide, please. Okay, so on this slide, you can see the national framework that CMS uses to guide the Rural Health Transformation Program. These 5 strategic goals apply to every state, and they shape how CMS evaluates progress each year. The first goal is make rural America healthy again. This focuses on prevention, chronic disease management, behavioral health, and maternal and prenatal care. CMS is emphasizing upstream health, not just treating illness, but building healthier rural communities over time. The second goal is sustainable access. CMS wants rural residents to have reliable, long-term access to care close to home. That means strengthening rural clinics, hospitals, and community-based providers so that they remain viable and resilient even in small or frontier communities. The third goal is workforce development. Rural areas are facing some of the most severe workforce shortages in the country, and RHTP is designed to help states recruit, retain, and support a high-skilled rural healthcare workforce, including behavioral health, primary care, and specialty providers. The fourth goal is innovative care models. CMS is encouraging states to rethink how care is delivered, whether it's flexible care arrangements, team-based models, care coordination, or value-based approaches that reward outcomes rather than volume. And the fifth goal is tech innovation. This is where the broadband connection becomes especially clear. CMS is prioritizing digital health tools, remote care, data sharing, cybersecurity, and emerging technologies. And none of these are possible without strong, reliable connectivity. So broadband is not just an add-on, it's really foundational to achieving this goal. So together, these 5 goals create a national roadmap for rural health transformation. They give states flexibility, but they also set clear expectations for measurable technology-enabled progress. Next slide, please. Okay, so one of the most important things to understand about RHTP is that it's not just a health program. As this slide says, it is a connectivity-dependent transformative initiative, and it really spans across all sectors. So whether it's government, education, healthcare, we really want to break down those silos. And I think that this webinar is especially important because there are still lots of folks that don't know about RHTP. So if you can do anything in terms of helping spread the word, that would be great. So telehealth, remote monitoring, digital diagnosis, AI-enabled clinical tools, none of these work without reliable broadband. And in rural communities, broadband is often the limiting factor, not the technology itself. RHTP explicitly encouraged states to identify connectivity gaps that affect health access. It encourages data sharing across sectors. It allows states to invest in cybersecurity, digital readiness, and technology adoption, all areas where broadband partners and anchor institutions play a critical role. Schools, libraries, and health facilities can serve as community access points for telehealth and digital health tools. And many states are already planning to use these anchors as trusted local hubs for care navigation, chronic disease management, and digital literacy. So the bottom line is this: RHTP cannot succeed without broadband, and broadband cannot fully deliver on its promise without being integrated into health transformation strategies. And we will go to the next slide, and I will hand it off.
Perfect. Thank you,
Sorry.
Sarah, so much. Um, so here at Shelby, a lot of our members are familiar with the rural healthcare program, and they might be wondering exactly how the RHCP compares to the rural healthcare program and what maybe where it doesn't compare. So I want to flip that question over to Jordan. Jordan, can you explain how the RHT program differs from the RHC program?
Yeah, absolutely. And just anecdotally, I think that's a really important question. I am by no means a rural health transformation program expert, but as we were working the Hill over the last year, we heard very well-meaning staffers say, we were talking about codifying the rural healthcare program or codifying aspects of the Universal Service Fund that supported rural healthcare. They'd say, well, won't that rural health transformation program take care of all that? Just not knowing that they're completely different lanes. So these are programs that serve very different, but potentially and hopefully very complementary roles. As Kristen mentioned, many of us here on the Shelby side are familiar, but if you're not, the rural healthcare program is really about supporting ongoing in perpetuity costs for rural healthcare providers, and that's specifically on the broadband connectivity side. So both the build costs and the ongoing costs. And we kind of here say sustainability is affordability. It creates a sustainable long-term connection to higher caliber of connectivity for healthcare providers, for the actual anchors. And it ensures that our clinics and hospitals and health departments have that high capacity service that they need. The Rural Health Transformation Program, on the other side, it is not about the network. And as far as I know, this is true across the states, but for the North Carolina plan, it does not fund capital builds like broadband expansion. And so that's really about what happens once connectivity is in place. This program is more about, like Sarah said, taking a transformational approach to how we deliver rural healthcare in face of all of these cuts that our providers are facing across the nation. So how can we expand telehealth access and workforce support and behavioral health services? So again, the rural healthcare program is getting our providers connected in rural areas and underserved areas, and RHTP is transforming how care is delivered. And if we zoom out just a little bit more, BEAD is focused on building broadband infrastructure. But as many of us on the Shelby side know, that was focused, anchors were less prioritized or lesser prioritized in that list. And that was more focused on the residential side, or for us, the patient side. So, these programs sort of form a stack. And the takeaway for all of that is that they sort of solve a different piece of similar challenges.
Thank you, Jordan. I love the way that you phrase that, that these are complementary programs. So we can see maybe a little bit of overlap, but we can really see where each program has its strengths and how they can potentially play off one another. I think that's extremely important. Thank you. Okay, so I want to pass it over now to Sean. So Sean, let's zoom out a little bit. I know you've been doing some work around analyzing the RHTP, plans across different states. And then I know one interesting aspect of this program is that we will see a variety of program goals. So each state's going to focus on, potentially something different.
Correct.
So while we know there are differences across plans, have you found any common themes?
Yes, and that's exactly right. As Sarah iterated, there was these 5 overarching program goals, and there was about 9 or so allowable uses of funds, of which the state kind of had to pick and choose from. And so it did allow the states to have a bit of flexibility as long as it aligned with, the 5 goals of the program. And these are just kind of 4 top line similarities or themes that I'm finding that as the states have kind of put out their abstracts or their plans, and it's early in the process. Some of these states are further building it out, but one big one, and I think that's very applicable here, is every state has said that they are going to focus on building out a telehealth infrastructure, right? And we know for telehealth to be really well received and well utilized. That's not just a broadband connection, but that's also how do people, do they have the devices that they need? Do they have a big, large format computer or device to be able to have that conversation with their doctor? Do they have the skills to be able to get on that Zoom call or access their, electronic health record through Epic or whatever it might be? So do they have the device? Do they have the skills? And do they have that connectivity? Do they have all of the connectivity that they need to be successful in using telehealth? All states are also doing some level of health IT modernization, digitizing healthcare records, trying to work amongst each other in these interoperable or like information exchanges. And so, how are the libraries and how is this community going to be able to help really support the efforts of these rural hospitals and these rural health networks? With regards to chronic disease prevention, that's blood pressure cuffs, that's, wearables. That's a huge area now. And again, that requires a connection, that requires the skills, and that requires the know-how to be able to make sure that patients and providers are using the technologies that are best available to them. And I think really number 4 is one that's really interesting is workforce training. We're training up communities. We're continuing education for doctors and for pharmacists to be able to serve people in rural communities. And so, we know that libraries are already stepping into those roles. We know that schools are already stepping into those roles. And so I think these are 4 areas of interest to the participants here that are found through every state and their plans that they've proposed.
Yeah, this is great, Sean. I love seeing, certain common themes, across different states. There was a question from one of our attendees that I think, might play into this a little bit. They ask, could states in theory implement pieces of their digital equity plans using this funding? And I think, that question goes to, a lot of states have already done a lot of planning around, digital opportunity, skills, training, things like that. So would you say that this funding opportunity provides them with that opportunity to explore maybe some of those, programs or goals that they've already thought through?
I open this up to all the panelists, but I would hope so. All of that planning that went into the state broadband plans, please, as Sarah mentioned, reach out to your state broadband offices. I think that's a really important connection to be made at the state levels too. But I'm sure a lot of people had, health digital navigator training programs planned, or working with rural hospitals on maybe building out kiosks in the libraries or the schools to be able to increase, access in their communities. And so from my perspective, I certainly hope that some of that, what was not able to be implemented through the capacity or the competitive grants could play some role here, because we absolutely see the value in that.
Great, thank you so much. I think I might have lost a little bit of broadband connection there when I was asking my question. So apologies if I cut out, but Sean, you were picking that up just fine. Thank you. I know we've got more questions coming in the chat. We're going to roll along a little bit more, but keep them coming and we'll keep fielding them. Okay, so now we want to zoom in a little bit. So Sean talked about, the common themes across states. So now we want to turn to specific state plans, and ask our other presenters to give us kind of a high-level overview of some of the goals that they're seeing. So first off, Sarah, I'll turn to you. What are some interesting things you're seeing in Utah as you follow this progress?
Thank you. So I just also wanted to echo what Sean said, that absolutely, if there was work done that wasn't able to be utilized, please use that, talk to your state office of rural health. And also another great resource are the TRCs. There are regional telehealth resource centers. There are also national ones, and make sure that you reach out to them as well, because they're super knowledgeable and have been involved in this space and can help connect the dots. So with that, let me highlight Utah as an example. Utah received $195 million for this first round of funding to transform rural health throughout sustainable generational investments. So 77% of Utah's geography is classified as rural, with 25 rural counties, which means that our need is significant. And Utah's strategy is organized around 4 pillars. The first is making rural Utahns healthy. So we're focusing on prevention, nutrition, chronic disease management, maternal health, and behavioral health. And you're going to see some common themes across these states. These are areas where digital tools can dramatically expand reach and impact. The second is workforce development, which is expanding rural training pathways and retention strategies. Utah is looking closely at how digital health competencies can strengthen rural workforce pipelines. The third is innovation and access, modernizing infrastructure, expanding service lines, and reducing out-migration for care. This includes bringing specialty care closer to home through telehealth and hybrid models. And then fourth is technology innovation, so improving telehealth interoperability, data sharing, and digital tools. And this is where broadband partners, anchor institutions, and technology providers have enormous opportunities to collaborate. So I think that Utah's plan reflects what we're seeing nationally, that rural health transformation is inseparable from digital transformation.
Thank you, Sarah. Jordan, same question. How is North Carolina preparing for this funding opportunity?
So our state plan, we have the second largest rural population in the nation. I feel like that's our claim to fame in the Shelby Group, right behind Texas there with Dan Catwich. And we're focused on serving 3 million rural residents across 85 of our 100 counties are rural. And this plan that they've written in North Carolina is going to touch around 400 healthcare providers. But the backbone of ours is really interesting. Ours is going to be based around something called NC Roots Hubs. And these are regional community-led networks that are aligned with our Medicaid regions of our state, which I believe there are 6. And I have a picture of that map kind of hotspotted out where those are here on the slide. And these are these Medicaid regions already do this, but these Roots Hubs are going to build on a connection of medical care, behavioral health, and social services, and just kind of off of the beaten path here. The way they're going to do it is right now there's an application process open for nonprofits, community health partners, healthcare providers that are in rural areas to apply to be the leader of the Root Hub. So there will be a leader, which I think is great because it sort of forces the hand of collaboration in those regions. That health systems that may see each other as competitors at times are going to have to learn to collaborate on care and collaborate on projects, which they're all very eager to do in North Carolina to improve access to care through this funding. And like I said, the application process is closed. They're in the review process for these leaders of these Roots Hubs right now. And around that structure, they're going to focus on things like prevention and chronic care, behavioral health expansion, workforce development, value-based care, and technology and expansion. Like Sarah said, a lot of these are very similar across the board. But one great exciting announcement is that they hired a director of our rural health transformation program in North Carolina. I had no idea it was going to end up as great as it did for us, but it is actually Maggie Woods, who was at our North Carolina Department of Information Technology, and she was leading up our Office of Digital Equity and the state broadband plans and doing all the BEAD planning. So the phenomenal part is that I have been racking my brain. How are we going to get them to see broadband is going to be so critical, not just for the patients, but the providers? The work is already done for us. So that is phenomenal to have someone that understands the key aspects of not just broadband infrastructure, but digital literacy to the adoption of that technology pillar for our plan.
Well, you seem to be getting a lot of excitement in the chat as well, Jordan.
Maggie is the best.
Jordan, before I leave you, there's a question in the Q&A that I think relates to what you were just talking about in terms of logistics here. So there's a question about who is applying for this money in each state. Is it the state broadband office? Can you just clarify the logistics of that?
Yes, great question. And I'm going to be honest, it was a little confusing to me in the beginning as well, just because I think this came out so quickly from CMS. And I learned, with others that worked closer with their states. In North Carolina, it's going to be the healthcare providers themselves applying to the state, which has received money from the federal government as Roots Hubs to distribute and fund certain projects based on our 6 pillars that we have in our state. I believe every state is different. The broadband office has nothing to do with like the initial pot of rural health transformation program funding, but they may play a role in other capacities. That remains to be seen.
Yeah, and I can jump in for Utah. So our Department of Health and Human Services has a website set up for RHTP, and they are actually posting their forecasting opportunities, and then they're also kind of subcontracting with sister agencies and departments to help manage some of this money. But they have said that all of their opportunities will be posted. They're shooting for May, so that it's very short term, May, June, but folks can find out about those opportunities by going to the website. There isn't anything explicit about that you have to be a healthcare provider to apply at this point, but we are encouraging healthcare providers to partner with, within their region and area to apply. So.
Very similar here, Sarah. Our DHHS in North Carolina is posting opportunities. Once our Roots hubs are announced, then the funding project opportunities will start to be made public and kind of next steps will be revealed.
Wonderful. Thank you for the clarification. And finally, I want to turn to Michael. Michael, what are some of the goals that you're seeing in Arkansas?
Well, it's similar in nature to what Sarah and Jordan and has already expressed. A lot of focus here in Arkansas will be on the food as medicine, food as nutrition, changing how that is educated out into rural areas. There's a lot of emphasis in Arkansas on chronic care disease prevention and management. There's $150 million set aside for equipment, provider payments, and things like that. One of the other goals or tiers is promoting access coordination, just like the other states. There's a lot of funding here for telemedicine platforms, for training, for educating people on using them, deploying them, training the caregivers either at the originating site or at the far end. There's a big effort here too for remote patient monitoring. When you think about it, and you've got to have, as everybody agrees, you've got to have broadband to be able to do remote patient monitoring. And that's one thing, you got to call out Jordan, her medical grade broadband. You got to have it if you're going to use EMR, and Arkansas is going to go through uh, the opportunities for people to upgrade EMRs, upgrade their cybersecurity programs. And if you look at what's going on in the marketplace, there's a lot of hacking of healthcare, of medical universities, things like that. And it's getting to the point where it's also hacking the medical grade device appliance makers. You don't want to have that happen and have something at home where your remote patient monitoring gets shut off or hacked, you know. Um, but there's going to be efforts here within Arkansas for training, certifications for people, that was brought out pharmacists, dental hygienists, things like that. There's funding in here set aside for mergers, acquisitions, and partnerships, your collaborations. If you do that too, you know, there are give or take about 40 Arkansas hospitals that have negative operating margins. So this is also going to be a way to have a large healthcare provider entity institution be able to help a rural hospital with a specialist, with connectivity. Um, so I see that as being a big thing. And there's facility upgrades in that and data system upgrades. You don't think about um, what you have to have in a rural area to upgrade and be able to deliver services, electronic medical records. Arkansas also is going to look at EMS equipment and vehicles and the technology, the dispatch systems, and communications. There's an effort in here too for workforce hubs. And I see that permeating from, say, universities, community colleges, down to high schools, junior and seniors in a high school getting health education credit from a community college and then furthering their education back to a university system. So there's things like that that are going to be interesting. There are a lot of dollars set aside for, again, telemedicine in the state. I think the total is about 266 million over this 5-year period. And Arkansas, the other panelists mentioned their amounts. Well, I think Arkansas's first year is about 209, 219 million. Overall, over a 5-year period, it's $996 million. So that in Arkansas, that can change. We've got 75 counties. 44 of those counties are in the Delta. They're poverty, they're chronic care, comorbidity locations, populations, aging. That's a big thing here too.
Wow.
Does that help?
Yeah, super impressive. Um, Michael, I know you and I were having a conversation about, we don't quite yet know what, specific projects, that each state will fund, but, you and I are always keeping up with, interesting examples of digital health. And I know that you had brought a couple of examples to the
Yeah,
presentation. So
yeah,
I know you wanted to share.
yeah,
These are just, Michael's always keeping track of what's going on out there. And so he thought it would be interesting to share some examples with folks.
yeah. And I want to make sure that everybody on the call understands this is something that exists right now, but it could be an opportunity for y'all to leverage. This is what I would call a dock in a box. These are shipping containers where telemedicine equipment has been put in rural areas in Texas. And the biggest thing to me is not how neat it is to use a shipping container. The neat thing is the partnership between Texas A&M and Texas Tech in providing specialists to these remote counties that may not have a hospital. There's 256, 57 counties in Texas when you stop and think about that. That's a lot of connectivity out to the middle of nowhere. But when you look at this, it's pretty cheap thrills. You don't have bricks and mortar. You put a box on a parking lot, provide it with utilities, provide it with broadband, and make sure, obviously, that it's heated and cooled. But this could be a good example of how to quickly roll out telemedicine services. But like with Jordan, it's how you set those hubs up and you develop your partnerships or collaborations. And when you look at something like this, it takes a huge effort to get disparate institutions to work together. Yeah, okay.
Yeah.
But I thought that was really cool.
Yeah.
It,
And you've
it,
got
Dock
one
in a
more
box.
it is.
Dock in a box.
We like that.
It
And then you
is.
have a second example as well, Michael. You want to share that one?
Yeah, this one is Ohio Northern University. Their pharmacy program has mobile pharmacy units. They travel across 3 counties, 16 locations, and then you can make appointments on their web-based system. So when that van rolls up in your town, library, school, you're there. And you stop and think about that for an aging population or home health care. It's huge. But these are examples of what are possible, I think, with this funding and how people could work together.
Thank you so much, Michael. So we want to now take a look outside of this state plan specifically and discuss who else can play a role in this funding. So I know there's been a lot of questions and conversation around partnerships. So Sean, let's first turn to anchor institutions. How can anchors like libraries, for example, play a role in this funding? What should they expect?
I think the details on that are still coming out, but I think they can play a role right now in the development of the plans. And so I think it would be I think there's not necessarily a clearly defined relationship between the rural health offices and some of the state broadband offices. So if you're still working with your state broadband offices, like I would encourage that relationship to be made, to make sure that they're reaching out to the rural health offices. Because I think, as much as we hope that the state governments are talking to each other, they may not be aware of the state digital equity plans. And we all know, right, education, healthcare, those were outcome areas. And, the rural populations were a specific covered population. So we've done a lot of, or you have all done a lot of research and work to, identify needs and identify gaps and barriers. And I think all of that information that was developed through that planning process would be, I would hope, very helpful to the rural health offices that are going through this process of developing the plans. And right, and that was engaged libraries and schools. And so I see a strong role being there in kind of as these plans are being more formally developed, is a great role for everybody to kind of play. But I think it was maybe, I don't know if it was Sarah or Jordan that mentioned it, right? But I don't know if libraries will be direct financial recipients from the funding that's coming out of the state, but really, how can they partner? How can they utilize their services? How can they be part of those, the partnerships, whether it's the hubs like in North Carolina, or any, iterations that are being done in other states. So it's really this partnership plan, working very closely with their state broadband offices, just to make sure that data and that information is being shared at this time.
Right, right. And Jordan, this might be a similar answer from you, but what about the role of nonprofit organizations?
Yeah, I have been thinking about this a lot, and I'm sure some of if my friends made it on the call today, are also laughing. We've been trying to figure out as nonprofits in North Carolina, like, where do we fit in all of this? Because, like we said, it happened quickly, and we also want to make sure we set aside our own self-interest to promote these great things we know we can do, and wait and see what the regional needs are of the providers first. Of course, big funding's coming. We heard from one of our providers a couple of weeks ago; they're being inundated already with sales, 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 sales. This is going to be great. You should purchase this for your RHTP projects coming up. So I think in a lot of cases, nonprofits and anchors are going to be the connectors and implementers, and sort of glue or bridges of these projects through rural health transformation, because we have trusted relationships in these communities, all the way from we're a nonprofit broadband organization to faith-based organizations and programs that provide device access or digital literacy access or food, housing, things that support the social determinants of health that are really critical to the rural health transformation program. You might think, today is a great example. Shelby's a nonprofit. You guys focus on broadband connectivity for anchors, but you're doing a webinar promoting information about rural health transformation program. That's just one of the ways that a nonprofit can show up in this space. And I think even though funding is going to flow through different entities, we should look at building on, I love what people brought up about BEAD. We should look at building on some of the things that were done there for our technology realm that most of us here will be more focused on. For example, we had a tech resource finder tool that Maggie did bring to my attention that would be great, because I was thinking, should we make a one-pager list of every broadband, fixed wireless device, digital literacy program for people that are Roots hubs to have? Well, we don't have to do that because a lot of it's already in our old BEAD resources. So we can just build on things that are existing instead of reinventing the wheel. But I think my one thing to everyone on this call and this audience is, it is kind of confusing from the outside, but get in touch with your office, DHHS, Office of Rural Health, whoever's overseeing this, and just start the relationship. Make them aware of what you can do and ask them how you can help identify where you fit regionally in your state.
Wonderful. So I want to get a couple of questions here before we wrap up. I want to go to Sarah. It wouldn't be a Shelby conversation if we didn't discuss some of the larger implications, right, of funding programs. We're always looking at programs and not necessarily just digging into the nitty gritty, but what is the larger impact they play? And I've heard things around workforce development, right, economic outcomes, things like that. Do you see this program initiating more support for healthcare related broadband initiatives, such as national telehealth mapping, for example?
Yeah, so I think that, RHTP is already sort of pushing states towards a deeper alignment, right, they should be, between healthcare and broadband planning. Because like telehealth and remote monitoring and digital diagnostics are central to the program, I think that states are being asked to identify where those connectivity gaps are that directly affect healthcare access. So this will naturally lead to a more hopefully sophisticated broadband health data integration, which includes telehealth feasibility mapping, hotspot identification, shared data sets. There's a lot of conversation going on about data sharing between health agencies and broadband offices. So RHTP doesn't explicitly fund a national telehealth map, but it definitely creates the conditions for one. And I know a lot of states are discussing this, and they're also discussing in some circles how to coordinate. And that's also where the TRCs, I think, can play an important role because a lot of them are looking at things regionally or nationally. So the program elevates the expectation that broadband is a core component of healthcare infrastructure. So as states build out their RHTP data systems, I think that we're likely to see a more standardized approach to mapping digital health readiness. Also connectivity barriers and anchor institution access points. I know in Utah, we're absolutely looking at how we can, we do some telehealth access point mapping already, and we're looking how we can partner and really expand that reach.
Wonderful. So I want to end with giving every panelist a final word on the program. So we know that the RHTP provides a tremendous and exciting opportunity for healthcare. This is a large investment, as we all have talked about, meant to help rural communities. We're anxious to see how it plays out, of course. So for everyone, if we just want to go around, what are you most excited to see come from the RHTP? Let's start with Jordan.
I am hoping to see more collaboration across the sectors, as we've talked about, across nonprofits and government offices and our anchor institutions. I saw some I was just flipping through questions in the Q&A. Great questions, all of them very focused at addressing the gaps that we know are still present. We have to remember we might not do it perfectly, but this is an opportunity. Sarah reminded us of that. It's an opportunity. It doesn't address all of the cuts, but it's an opportunity to collaborate and to pull together some folks that have been working in silos for years and build something transformational upon those resources.
Yeah, yeah. Sarah.
Yeah, I'm going to echo what Jordan just said because I think that there's a lot of concern out there, I think, especially within the rural provider community, about how these dollars or if these dollars will make it to them, honestly, just because each state's doing it a little differently, and the communication around it also varies from state to state and how to access those opportunities. But I am hoping that we can all rally together and start having those conversations between the sectors. So the government agency folks and the healthcare folks and the broadband folks and the educational folks to really come together and develop some like strategic plans in response to your state's plan. So really, become knowledgeable about what your state's plan looks like. Most of them are available online on the various websites, and really consider how you might be able to partner in your region or throughout the state or whatever that looks like to be able to bring this to reality. So because this is a tremendous opportunity, the timelines are tight. And so there's a lot of pressure, and yet, we're also trying to be very strategic and make sure that we have the sort of foundational pieces in place to be able to build on that over the years and then make it sustainable because we've only had the 5 years. So it's important for us to come together.
Yeah, thank you. Sean, anything else to add?
I would just say I think at HRNA we firmly believe that healthy communities is strong communities. So I'm really looking forward to the impact on the ground in creating healthier communities, stronger communities, hopefully economic growth and development. And I'm looking at that broader impact as well.
Yeah, yeah. And then finally, Michael, last word.
Last word. Okay. Then think back to the BTOP program. That was almost 15 years ago. Think about that a minute. That enabled broadband push out. It enabled collaborations in each state to partner for the dollars, for the broadband, for the healthcare expansions. So you've gone about 15 years until this comes in. And I would like, I think like all of us, I would like to see the collaborations among disparate healthcare providers, institutions, service providers. One thing that, Arkansas is very rural. It doesn't have the mountains like Jordan has. Um, but I see the opportunity for remote patient monitoring in rural areas, but you got to have the power, the electricity, and you got to have the broadband. To me, this is going to open up a world of opportunity for electric co-ops that provide broadband because you think about it, it'll push it into the home, it'll be reliable, and a healthcare provider somewhere in that state can respond. You can put remote patient monitoring appliances in the home or schools, libraries, wherever it may be. Okay, that's the last word. Thanks.
Thank you, Michael. Thank you so much to all of our panelists. I've captured the questions that we were not able to get to, so I've got those myself. I'll pass it back over to Joey to end the webinar.
First of all, that was an excellent webinar. Huge thanks to our speakers. This is an extremely timely and important topic, and I wish we had more time. That was just a tremendous amount of important information. Also want to let folks know that if you want to rewatch it, it'll be on our website, but also if you don't want to rewatch it, but you want to make sure your colleagues and others watch it, it'll be available on our website. So please do check it out. We also want to thank our sponsors again, Ready, Zayo, T-Mobile, Tirana, and Cisco. This would not be possible without them. Also, just a reminder, if you've enjoyed these webinars, please become a Shelby member today. It's easy to sign up. Two more quick announcements. One, we'll be having another webinar. Our next in our series of Shelby webinars is on May 6th. And we'll be taking, again, a look at the Universal Service Fund and the continuing litigation. This time, we're back in the Fifth Circuit. So please tune in then. I'd also like to encourage everyone on this webinar to attend AnchorNets. AnchorNets is the nation's leading broadband conference for anchors. It's where broadband policy meets real-world action. So I would encourage you to take advantage of early bird pricing and register today at anchornets.org. So we hope to see you in person in Crystal City, Virginia, October 7th through 9th, and hope to see you even sooner on a Zoom sometime between now and then. So thank you for attending and have a great day.